Imagine discovering that your feet have been quietly warning you about serious liver trouble long before any blood test ever could. Changes in color, temperature, pain, or even the way your feet feel when you walk might not be random at all. They could be urgent signals from one of the most overworked organs in your body, your liver. Your feet are far from your liver, yet they are deeply connected through circulation, nerves, hormones, and detox pathways. The liver is like the body's central processing plant. It filters toxins, regulates blood sugar, manages fat metabolism, stores vitamins, balances hormones, and produces bile for digestion. When it starts struggling, the body looks for alternative ways to communicate distress, and the feet often become one of the earliest and most visible places where problems show up. One of the first signs people notice is swelling in the feet and ankles. This isn't just from standing too long. When the liver becomes damaged or fatty, it struggles to make enough albumin, a protein that keeps fluid inside blood vessels. Without enough albumin, fluid leaks into surrounding tissues, and gravity pulls it downward, straight into your feet. You may notice your socks leaving deep marks, shoes feeling tight by midday, or puffiness that doesn't go away overnight. This type of swelling is a red flag, not a normal aging issue. Another common but overlooked sign is redness or heat in the soles of the feet. This can happen because liver dysfunction affects hormone balance, especially estrogen. When estrogen rises abnormally, blood vessels dilate. This causes increased blood flow to the skin, making the soles feel warm, flushed, or even burning. Some people describe it as walking on hot pavement even when the room is cool. This sensation isn't coming from your feet themselves, but from chemical signals your liver can no longer regulate properly. Cracked heels may seem like a simple skin issue, but they can point toward deeper nutritional deficiencies caused by poor liver function. Your liver stores and activates fat-soluble vitamins like A, D, E, and K. When bile production is impaired, fats and these vitamins aren't absorbed properly. Vitamin A deficiency can lead to dry, thickened skin, especially on the heels. No amount of lotion will fully fix this if the root cause is internal. Pay attention to yellowish tones in your toenails or the skin around them. While many people assume this is fungus, it can also be related to bilirubin buildup. Bilirubin is a waste product processed by the liver. When the liver is overwhelmed, bilirubin can accumulate and subtly discolor tissues, including the nails. This is often one of the earliest visible clues that detox pathways are backing up. Another strange but important signal is numbness, tingling, or burning sensations in the feet. The liver plays a major role in regulating blood sugar. When liver function declines, blood sugar instability increases even before diabetes is diagnosed. This can damage small nerves in the feet, leading to peripheral neuropathy. You may feel pins and needles, electric sensations, or reduced sensitivity. Many people chase nerve treatments without ever checking their liver health. Foot cramps, especially at night, can also be connected to liver stress. The liver stores minerals like magnesium and helps activate vitamin D. When these are deficient, muscles don't relax properly. The result is painful spasms in the arches or toes that strike when you're resting. These cramps are often dismissed as dehydration, but the deeper issue may be impaired mineral storage and activation by the liver. Then there's an often ignored sign: itchy feet. Chronic itching without a rash can be a bile flow problem. When bile becomes thick or sluggish, bile salts can spill into the bloodstream and irritate nerve endings in the skin. The itching often starts in the hands and feet because they have a high concentration of sensory nerves. Antihistamines won't help because this itch isn't allergic, it's metabolic. You might also notice changes in the shape of your feet. Loss of muscle tone in the arches or thinning of the fat pads can occur when protein metabolism is impaired. The liver plays a huge role in converting dietary protein into usable building blocks. When this process falters, the body begins breaking down its own tissues, starting with areas that aren't considered essential for survival, like the small muscles in the feet. Even foot odor can tell a story. A struggling liver can't neutralize toxins efficiently, so the body pushes them out through the skin. The feet, packed with sweat glands, become a major exit route. This creates a stronger, more persistent odor that returns quickly even after washing. What makes all of this so important is that many people with liver problems don't feel pain in their liver at all. The liver has very few pain receptors, so instead of sending pain signals, it sends subtle warning signs elsewhere especially to the feet. By the time fatigue, nausea, or abdominal discomfort show up, the problem may already be advanced. The good news is that the liver is one of the most resilient organs in the body. When you catch these signs early, especially the ones appearing in your feet, you have a powerful opportunity to reverse damage and restore function. But first you have to learn how to listen to what your body is saying. And this is just the beginning. There are several foot-related signs most people never associate with liver health that can reveal exactly what kind of liver stress you're dealing with and what your body is lacking right now. When the liver is under chronic stress, circulation to the feet often becomes sluggish. This can cause your feet to feel unusually cold, even in warm environments. The liver helps regulate blood flow by managing fats, hormones, and inflammatory signals. When fat builds up in the liver, blood becomes thicker and less efficient at delivering oxygen to the extremities. Cold feet that persist despite normal temperatures can be a circulation issue rooted in liver congestion, not just poor footwear or weather. You may also notice a bluish or purplish tint to the toes. This can happen when the liver fails to properly filter toxins and excess hormones, leading to vascular constriction, blood pools in the lower extremities, and oxygen delivery drops. Over time, this lack of oxygen stresses tissues and can slow healing. Cuts, blisters, or cracked skin on the feet may take much longer to recover, which is another silent signal that something deeper is wrong. Fungal infections that keep coming back can also point toward liver weakness. The liver is central to immune regulation. When it's overwhelmed, your immune defenses weaken, allowing yeast and fungi to thrive, especially in warm, moist areas like between the toes. Repeated athlete's foot or toenail fungus that doesn't fully respond to treatment may not be a hygiene issue at all, but a sign that your detox and immune systems are compromised. There's also a fascinating link between foot reflex points and liver stress. While not diagnostic on their own, many people report tenderness or pain along the inner arch of the right foot, an area traditionally associated with the liver. This sensitivity may reflect nerve irritation caused by systemic inflammation. When the liver struggles to clear inflammatory byproducts, they circulate and irritate nerves throughout the body, including those in the feet. Pay attention to changes in skin texture on the feet. Thickened, rough, or leathery skin can develop when insulin resistance increases. The liver plays a major role in managing blood sugar and converting excess glucose into stored energy. When it becomes fatty or inflamed, blood sugar rises, triggering skin changes caused by glycation, a process where sugar binds to proteins and damages tissues. These changes often show up on the feet before they appear elsewhere. Another subtle sign is excessive sweating of the feet. A stressed liver alters the autonomic nervous system, which controls sweating. When toxins build up, the body tries to release them through sweat, especially in areas with many sweat glands. This constant moisture further increases the risk of infections and skin breakdown, creating a cycle that won't resolve until liver function improves. Pain when walking, especially a dull aching or burning sensation, can be tied to fat metabolism problems. The liver is responsible for breaking down fats and producing ketones for energy. When this process is impaired, muscles don't get efficient fuel, leading to early fatigue and discomfort. This is often mistaken for aging or foot mechanics, but the root cause may be metabolic. What's critical to understand is that these foot signals don't appear randomly. They reflect specific liver-related imbalances: poor bile flow, fat accumulation, hormone disruption, mineral deficiencies, and toxin overload. Each sign is like a dashboard warning light, and the feet are simply the place where those warnings become visible. So, what causes the liver to reach this point? The most common culprits are excess sugar, refined carbohydrates, alcohol, industrial seed oils, chronic stress, and frequent snacking that never allows the liver to rest. Over time, these factors create fatty liver disease, insulin resistance, and inflammation, even in people who are not overweight. The encouraging part is that many of these foot symptoms begin to improve quickly when liver stress is reduced. Supporting bile flow, stabilizing blood sugar, replenishing minerals, and reducing toxins can lead to noticeable changes in swelling, temperature, sensation, and skin health within weeks. One of the most powerful steps is removing sugar and refined carbs, which directly overload the liver. Increasing healthy fats allows the liver to shift back into fat-burning mode. Supporting bile production with nutrient-dense foods helps improve digestion and vitamin absorption, which directly impacts skin and nerve health in the feet. Intermittent fasting can also give the liver a much-needed break. When you stop eating constantly, the liver can focus on repair and detoxification instead of non-stop processing. Many people notice reduced foot swelling and improved warmth within days of giving their liver this rest. But there are still a few critical foot signs that reveal whether your liver damage is mild, moderate, or progressing toward something more serious. These signs can tell you when it's time to act immediately rather than wait. One of the most concerning foot signs linked to advanced liver stress is persistent, deep swelling that doesn't respond to rest or elevation. When this happens, it suggests not just low albumin, but increased pressure in the portal vein system. This condition forces fluid out of blood vessels more aggressively, and the feet become reservoirs for that excess fluid. The skin may feel tight, shiny, or painful, and pressing a finger into the skin may leave a dent that takes several seconds to disappear. This is no longer a subtle warning. It's a call for immediate attention. Another serious indicator is darkening of the skin around the ankles and tops of the feet. This can be related to insulin resistance and iron overload, both of which are closely tied to liver dysfunction. The liver stores iron, and when it becomes damaged, iron regulation breaks down. Excess iron creates oxidative stress that damages tissues and alters pigmentation. This discoloration is often gradual, so people overlook it until it becomes pronounced. Loss of sensation in the feet, where you barely feel temperature changes or pressure, can indicate long-term nerve damage. This often occurs when liver-related blood sugar instability has been present for years. The liver's failure to buffer glucose leads to chronic nerve irritation and eventual nerve death. At this stage, damage may not be fully reversible, which is why early foot symptoms should never be ignored. You might also notice deformities developing in the toes, such as curling, stiffness, or reduced mobility. These changes can result from chronic inflammation and protein malnutrition. Without adequate liver function, the body cannot properly rebuild connective tissue. Over time, tendons shorten, joints stiffen, and the natural alignment of the foot changes. Even the way wounds behave on your feet can be revealing. Liver dysfunction reduces the production of clotting factors and slows tissue repair. A small cut that bleeds longer than usual or heals very slowly may be a sign that the liver is struggling to produce the proteins needed for repair. This is especially important because foot wounds are already at higher risk due to reduced circulation. At this point, it's clear that the feet are not just passive structures at the bottom of the body. They are active messengers, constantly reflecting what's happening internally. The liver, when overwhelmed, sends its distress signals downward through changes in fluid balance, circulation, nerve health, skin integrity, and immune defense. The key takeaway is awareness. Most people wait for lab tests or severe symptoms, but the body often whispers before it screams. By noticing changes in your feet early, you can intervene while the liver is still capable of remarkable regeneration. Supporting liver health doesn't require extreme measures. Reducing sugar and alcohol, increasing nutrient-dense whole foods, prioritizing healthy fats, allowing periods of fasting, managing stress, and avoiding unnecessary medications all reduce the burden on the liver. As liver function improves, many people notice their feet becoming less swollen, warmer, more sensitive, and healthier in appearance. Your feet can become a progress report. Improved circulation, reduced itching, stronger nails, better skin texture, and fewer cramps are signs that your liver is recovering. The body has an incredible ability to heal when you remove what's harming it and provide what it needs. And the most empowering part is this. Once you know what to look for, your body is constantly giving you feedback. Your feet are not just carrying you through life. They are quietly telling you how well your liver is supporting you from within. If there's one thing to remember, it's this. Your body is always communicating, and your feet are one of its most honest messengers. Long before lab results turn abnormal or serious symptoms appear, subtle changes in swelling, color, sensation, temperature, skin, and nails can quietly reveal how much strain your liver is under. These signs aren't random, and they're not just cosmetic or age-related issues. They're early warnings. The liver works silently and tirelessly every single day, filtering toxins, balancing hormones, regulating blood sugar, and fueling your metabolism. When it becomes overloaded, it doesn't cry out in pain. Instead, it sends signals downstream, and the feet often show those signals first. Learning to recognize them gives you a powerful advantage: time. Time to reduce damage, restore function, and support healing while the liver is still highly capable of recovery. The most important step is not fear, but awareness followed by action. Small changes in diet, lifestyle, and daily habits can dramatically reduce liver stress and lead to noticeable improvements, not just in your feet, but in your energy, digestion, mental clarity, and overall health. As the liver heals, the feet often follow, becoming warmer, less swollen, stronger, and more comfortable. So the next time you look at your feet, don't see them as separate from your health. See them as a reflection of what's happening inside your body right now. When you listen early, your body doesn't have to shout later.